Intravenous access devices are characterized as either peripheral or central, depending on whether the distal end of the device terminates in the peripheral veins of the body or the larger central veins. Peripheral venous access devices include peripheral intravenous cannula and midline catheter. Central venous access devices include peripherally inserted central catheter, non-tunneled central venous catheter, tunneled cuffed central venous catheter, tunneled non-cuffed central venous catheter, subcutaneous implanted intravenous port, and hemodialysis central venous catheter. Peripheral intravenous cannula is a small flexible tube that is most commonly inserted in the veins of the hand, forearm, or region of the antecubital fossa. PIVC is used for the infusion of non-irritating, non-vesicant treatments. A midline catheter is a longer peripheral cannula most commonly inserted into the upper arm via the basilic, cephalic, or brachial veins, with the internal terminal tip ending at or near the armpit area. A peripherally inserted central catheter is a central venous cannula inserted through peripheral veins of the extremities, with the tip residing in the distal portion of the superior vena cava or inferior vena cava. The only difference between a midline catheter and a PICC is the length of the catheter. A midline catheter terminates at or near the axillary area, whereas a PICC line terminates in the distal portion of the superior vena cava or inferior vena cava. Non-tunneled central venous catheters are inserted via percutaneous access into the internal jugular, subclavian, axillary, or femoral veins, and are typically used for patients in acute care requiring critical access. A tunneled cuffed central venous catheter exits the vein in one location and is tunneled under the skin to a separate exit site. These catheters are held in place by a small cuff that allows tissue to grow around the catheter, thereby providing stability to the catheter and preventing catheter from dislodging. Therefore, these catheters are suitable for long-term use. Tunneled non-cuffed central venous catheters are tunneled beneath the skin, however without a cuff at the exist site. Tunneled non-cuffed central venous catheters are for short-term use and do not require a general anesthetic to remove as does not have a cuff. Subcutaneous implanted intravenous port is placed under the skin, usually in the right side of the chest. It is attached to a catheter that is guided into superior vena cava. A needle is inserted through the skin into the port to draw blood or give fluids and other treatments. A port may stay in place for many weeks, months, or years, also called portacath. Hemodialysis central venous catheter is a type of central venous access device specifically designed to facilitate kidney replacement therapy in patients without a functioning long-term hemodialysis vascular access. The lumen of a hemodialysis central venous catheter has a larger diameter, compared with that of a typical central venous catheter used for infusion to provide a desired extracorporeal blood flow of 300 to 400 milliliter per minute.